and welcome into Your Health. You know, as we start to get a little bit older, sometimes we figure out that we need a little bit of a lift. You know, it's a little harder to get out of bed in the morning, and when you do get out of bed in the morning, sometimes you kind of look in the mirror and you say, whoa, is that me? Well, yes, you are getting a little bit older, and sometimes the lift might be that you might need something done to yourself cosmetically that can help you a little bit better. And my guest is Dr. Michael Bowman, and Dr. Bowman, you've got something to give somebody kind of a quick lift, don't you?
That's right. The quick lift is the name of the procedure that my partner, Dr. Tom Cawthon, and I perform.
Mm-hmm.
And the quick lift is a modification, a newer version of the facelift type procedure that allows a quick rejuvenation that proceeds quickly with less downtime and swelling that is usually associated with some of the older procedures.
Because when a person, obviously, the picture in your mind when you say, well, I'm going to have a facelift, is you think, oh, well, this person's going to probably be sequestered for about a 3-week period of time while they're kind of recuperating from this whole procedure, because the old way and the full facelift does take quite a bit more, doesn't it?
It does. You tend to have a little bit more swelling, a little bit more downtime and bruising and these kind of things. The basic idea is that well, the quick lift it's not a one-size-fits-all procedure. The most important part is usually when a patient is interested, they often come in, like you said, where they look in the mirror and they
don't
feel,
recognize the person. Huh?
Yeah, they say, I feel a lot younger than what I look. And so coming in for that consultation, and they come in, and for a lot of people with aging changes in the lower half of their face, those are usually patients where the quick lift is an important part of the rejuvenation scheme.
So basically, quick lift focuses more from below the eyes down.
That's right. So primarily it focuses on the neck and jawline and the heaviness here under the neck as well. It can be combined with other procedures like eyelid rejuvenation or forehead work or anything else that needs to be done. The aim, of course, is for a very natural, youthful appearance where someone appears invigorated but very natural in their appearance and a very
they haven't
harmonious
changed
look.
180 degrees. It's still the old guy.
Exactly. It should be a very harmonious look where the ideal reaction if someone hasn't seen a patient for a while is just, oh my gosh, you look wonderful. It's
not, ooh.
Yeah, exactly.
Who's this guy? Yeah.
Exactly.
Yeah. Basically then, as we age, what causes those things to happen? Is it parts of our body are shrinking while others aren't keeping up with it? Or?
Well, the two things that tend to cause the most change are thinning of the skin and loss of volume. If you compare an older picture to a look in the mirror to a younger picture, oftentimes it's changes in volume that show up the most, where there's hollowing and loss of volume along the cheeks and through here. So especially in someone that hasn't gained weight, you tend to you can start to see the bones of the face underneath that tend to show through, and then the thinning that also comes down as things start to descend a little bit in. And so the quick lift uses some sutures to pull those volume that has sagged and gone down in the face to kind of pull it back up to a more youthful position and put that volume back up to where it should be.
And is this a procedure that's done in the office, or does it need to be, you don't have to go into surgery like you do for a full facelift?
And that depends really on the patient. It can be performed in the office setting. Oftentimes when patients come to see us in consultation, it becomes very clear that they like the idea of having it performed in the office, or some people are rather nervous about an office type procedure and would do better with a general anesthesia.
Yeah.
So.
And of course your practice here is called Montgomery Otolaryngology.
That's right.
It's a long word which combines all the eyes, ears, nose, and throat. You do a lot of things in those areas.
Yes.
And, now, is your specialty in the area of the facelift, or is it?
I do have a general ENT practice, but I
Okay.
specialize in facial plastic and reconstructive surgery with reconstruction of cancer, skin cancer problems and things like that, but also the aesthetic reconstruction.
And you work in conjunction. Do you do some of the stuff at the spa?
Yeah, we do it at the spa,
And that's called
at the New Image Spa.
the New Spa. That's out in the East Chase area.
That's correct. That's correct, and that's where typically we see our consultations out there. And then, but the procedures can be done at the surgery center if the patient or we decide that it might be a better place for the individual.
Okay. And they can just call you people directly here for a consultation. They don't have to go through their primary physician. No.
No, they can just come on in, and we'll have the full consultation should leave with the patient having had all their questions answered, having their concerns addressed, so they know what the doctor should understand what their concerns are about their appearance, and they should have a plan for what we think the best way to move forward is.
It actually works very well because Dr. Bowman is 75 years old. No, just kidding. No, this guy, I have socks probably older than this young man, but it's a pleasure to be with you today. And just remember, as we said earlier, if you're looking for something that's a lift in your life, it may be the fact that you can have something done with your face even at this stage of your life. We'll be right back right after this.